welcome to the Art of Being Human. You know, in all of these classes that I've done on diabetes, I think that we have established the fact now that diabetes affects every organ system in the body. It affects every cell in the body, and everything that you do, everything you eat, since it's especially food related. I'm not saying that eating causes it, but your body has to respond to all of the carbohydrates and the protein and the fats and so forth that you eat. So every cell in your body is somehow affected, and you have complications as a result of this. Usually complications don't get started until about 15 years or so after you started being diabetic. I know when I started being diabetic, well, I didn't have any complications right away. I felt pretty good. But on the other hand, there are some people who become diabetic and they don't know they're diabetic, and it's not discovered until after complications already get started. And it's also true that you can be diabetic for about 5 to 7 years before you even have a clue that something's wrong. With me, it was foot infections. Now that's a complication, but I didn't have other things. I wasn't thirsty all the time. I wasn't tired all the time. I led a normal life, but I had foot infections a lot. And it was through that that the doctor tracked it back and discovered that I was diabetic. And so, so you can live for quite a while without feeling bad. But after about 15 years or so of diabetes, you start to feel the complications, and they can get to be more serious. And these are the kinds of complications. I'm going to give you a list here. Cardiovascular disease, which is heart disease. Cardio is heart, and vascular has to do with blood vessels, so you put them together. You have cardiovascular disease, which influences the heart and the blood vessels. You can have retinopathy, that's eye disease. Nephropathy, which sounds a little like retinopathy, but nephropathy has to do with kidney diseases. Then you have neuropathy, which is nerve disease. Then you have infections. And these are basically the kinds of complications you're going to get. Complications of the heart, the eye, the kidneys, the nerves, and then the infections. And what I'm going to do now is just show you a couple of charts that I have here. Since it's a whole body thing, I want to review with you the locations of some of the organs and how that relates to diabetes. So these are just kind of hand sketches that I've done. So if we take a look at this diagram right here of the human body, I don't have all the organs in here, but I've got quite a few. You start with your mouth, the esophagus. Then you go down, as far as food is concerned, it goes down to the stomach, then it goes to the the small intestine, then it goes to the large intestine, and then goes out. Eventually, it goes to the bloodstream, or it goes out because it's not going to be used. So take a look at all of this. The mouth, the esophagus, the stomach, the small intestine, the large intestine, and then out the rest of the body by the rectum. That's all a part of the alimentary canal. The alimentary canal includes the mouth, esophagus, stomach, small intestine, and large intestine. Now, when usually we talk about the alimentary canal, we're talking about where you swallow when it's going down to the stomach. But really, it involves everything else. And in addition to those organs I've just mentioned, the liver gets involved with digestion. Now, I have the gallbladder right here. It's really in the back of the organ. The spleen gets involved. That's in the back of the stomach, below the diaphragm, and there's no way I can draw it in here. You get the pancreas. That's definitely involved with the digestive process. It's not just because it creates insulin, but it has digestive juices as well. That all of these organs, the small intestine, the large intestine, liver, gallbladder, pancreas, stomach, they're all involved with the digestive process. So what I am going to do, and I'm not going to do it today or next session, but after that, I'm going to go into a special segment just on digestion, because it's so critical. You know, the problem with diabetes and controlling it, it's not just an illness and you take a pill or you take medication or you do exercises, whatever you do, but you have to eat every day. You don't have to drink every day. You don't have to take drugs every day. You don't have to smoke every day. You can get rid of all of that stuff, and you should. But eating you have to do every day, and diabetes is so edged around the eating process and the digestive process that when you think about it, we eat and diabetes is affected. We eat carbohydrates, proteins, salts, fats, whatever, and diabetes is affected. The organs are affected. The way you digest it is affected, and we're going to go into all of that. But I wanted to show you these diagrams. I have another one here I want you to see. Not everything can be drawn in one drawing. So here's your heart, but down here you have the pancreas. That would be behind the stomach. Of course, I couldn't draw that in. And then you have your adrenal glands on top of your kidneys. The kidneys are here, the larger ones, and then the adrenals are right on top of them. And that sets, in the stomach area is so compact, but one organ is in front of another, is in front of another, and is in front of another. Then you have the kidneys, and that's it. These are organs that I couldn't draw in for the other drawings that I had. So getting back to general information, if you are a diabetic, you are 2 to 4 times more likely to get heart disease than other people. You are 5 times more likely to have a stroke than non-diabetics. Cardiovascular diseases cause more than half of the deaths of older people who have diabetes, due to the fact that the blood vessels get clogged up. Heart disease usually happens when your blood vessels are clogged up. What would clog them up? Well, you have sugar in your blood. It sticks to the blood vessels, and when it sticks to the blood vessels, it can't get through. It has a harder time getting through. Remember, your extremities are your hands and your feet, and they have smaller blood vessels, even your eyes. They have little tiny, tiny blood vessels that are called capillaries. These capillaries get stuck. They had the blood in them, get stuck, it can't flow right. Then sometimes it slows down the blood flow, sometimes it stops altogether. So you have a real problem. So eating too much fat and cholesterol will clog the arteries. Then you have diabetic neuropathy. Now I've talked about neuropathy a little bit. The dumbness, the tingliness of your hands and your feet, the pain, the itchy feelings, and it can be miserable. But you can get neuropathy all over your body. For example, you can have nerve damage from neuropathy. It can affect your digestive tract, your heart, your digestion, and you can get indigestion, you can get diarrhea, you can get constipation, you can get a lot of cramping and a lot of pain. You can even get dizziness and bladder infections and impetus, and you actually can also have a condition called gastroparesis, and this is what we're going to be getting into as I get into it. Gastroparesis is a digestive problem caused by neuropathy, where your digestion actually slows down. I know a person with gastroparesis, and she's been to doctors with it, she's treated for it, and it's been very difficult for her. Basically, her intestines don't work anymore. They've gone to sleep. She can't get them to contract. So she has a lot of pain, a lot of bloating, a lot of gas, a lot of medication, a lot of diarrhea, and she's in absolute misery. And it is gastroparesis. But what caused the gastroparesis is the fact that it's really the nerve damage, the neuropathy that she gets that affected the nerves of her stomach and of her intestines. Now, you don't always have to be diabetic to get this, but it is more prone in diabetics than non-diabetics. Then you have, with the gastroparesis, nausea, vomiting, bloating, loss of appetite, and so forth. And if the esophagus is involved, and sometimes it is, it can be very hard for you to swallow. So you have a group of symptoms here that are very, very difficult. Now, how do you know if you've got complications? As I said, a lot of times people don't have a lot of complications until they have had diabetes for about 15 years. Other people, the fact that they have the complications, it's what draws the doctors to discover that they already have had diabetes. It's not unusual for you to have it 5 to 7 years before you even know anything about it, because you don't experience symptoms. So what kind of tests do doctors give you to see if you have complications? That's why if you're diabetic, you're going to the doctor more frequently. They are constantly checking you to see if you are getting complications. And it's important that they do so, because if they don't, you could get yourself in real trouble. You could go blind, for example. There are other things you could do. So these are the tests that are usually given to people who are diabetic. Every 3 months, you usually go to the doctor just for a diabetic checkup. They make sure that your blood flow is all right. They can check your blood flow, and that they will take your blood pressure. And when they take your blood pressure, sometimes they take it on both sides, you know, where they put the strap around your arm. They do it on both sides and compare what the results are on both sides. Now, I asked a nurse why she did that. You know, you get the blood pressure for one arm. Why do you have to do it in 2 arms? Well, the reason is if you have a blockage in your artery, it's going to show up by a vast difference in the blood pressure between one arm and the other arm. That shows there may be a blockage. If they're similar, then they don't have to worry about a blockage, and that's the reason that they do it. So you get your physical checkup every 3 months, and then every 3 to 6 months you have an A1C test. I'm going to be going into that today. That is a blood test that shows what your average blood sugar has been for the last 3 months. It really does work, and I've often wondered, how do they do that? For every 3 months, they can tell you what your average blood sugar has been. But they can, and there are reasons they can. I'll be getting into that. Then once a year, you have a test for your cholesterol, HDL, LDL, kidney tests, eye tests, foot tests, and any other tests that are necessary for your health that the doctor is picking up on. Because, you know, sometimes you can feel when you're getting blood sugar changes. If you're getting too low, you get the faintness, the dizziness, the shakiness if you're too low. And sometimes if you're going up too high, you can feel it too. You get tired, logy, and so forth. There are different symptoms for each person, and you get to know what your own symptoms are, and you can make a judgment. But the problem is there are a lot of things that are happening in your body that you can't feel. If your blood pressure is going up and it's too high, you don't necessarily feel it. If arteries are being damaged, you don't necessarily feel it. And so I want to make this comment about smoking. If you are smoking, you really need to stop, because if you are smoking, you are damaging. It does terrible damage to the blood vessels. And when I go to the doctor, I'm often asked, are you smoking? Well, I never have smoked. And it's fortunate for me, because it does awful damage to the blood, to the arteries, especially in people who are diabetic. So one thing you can do to help yourself is not to smoke. And I don't want to just harp on it, but it is true. Now, what about diagnosis? How do you know? How do they diagnose you as being diabetic? For this, I'm going to use a chart that will be on the screen. This would be chart number 1. Here is a diagnosis of diabetes. There are 2 tests that I want to discuss. I'll just go over this chart, and then I will talk about it more in depth. The first test is called the fasting blood sugar test. And in that test, you take a blood test usually in the morning after you have fasted all night. And usually you can't eat for about 8 hours. And then in 8 hours, you can have this blood fasting test and then take a sample of your blood and see how high it is. Now, in terms of diabetes, if the doctor suspects that you're diabetic, and he may even know it, you still have to be diagnosed. So you would go to the hospital, or you would go to a lab after 8 hours of fasting, and they would take a sample of your blood. And if it's above 125, You take another test a week later, and if it's above 125, then that is a very definite diagnosis of diabetes. In other words, you need to have 125 on 2 consecutive tests, blood tests, taken 1 week apart. That's one way of discovering whether you're diabetic or not. So we can go to the next chart. The glucose tolerance test is another test that they give you to find out whether you're diabetic. This is a little more difficult to take. What happens is you may be on a special diet for 2 or 3 days, and you go to the hospital and they give you a ridiculously sweet drink. It's basically glucose, extremely sweet to where it's hard to get it down. And you drink it, and that shoots your blood sugar high because they're not giving you any insulin. And you stay at the hospital, or sometimes you can go and come back. These tests are usually for 3 hours, but they have given them for 6 or 7 hours. And they test your blood sugar every so often, like every half hour or every 20 minutes if it's a 2 or 3 hour test, or every hour if it's a 7 or 8 hour test. And you can either leave and go back to the hospital for a blood test. And what they are finding out, they're not giving you any medication. What they are finding out is how fast does that blood sugar go down. It doesn't go down fast, it doesn't not go down at all, and they can tell by that whether you are getting good insulin that's working, because it should be going down at a certain rate, and if it's not going down at a certain rate, then they can ascertain whether you are diabetic or not. So those are the 2 tests that you would be given to determine whether you are diabetic. Okay, so now I want to get to the red blood cells, and what I'm going to do is show you this chart first. The red blood cells, they're red because of a substance called hemoglobin. So sometimes they're called hemoglobin cells, hemoglobin red blood cells. The hemoglobin is in fact, if we look at this, I didn't color it in, you can see better if I don't. But what happens is that hemoglobin is a substance, and it's in the blood, and it carries oxygen, and it's what gives the cell its red color. Another interesting thing about the blood cell is that it does not have a nucleus. Most cells have a nucleus, but the red blood cell, once it's created, once it's in the bloodstream, it loses its nucleus, and it no longer has a nucleus, but it's red because of the hemoglobin in it. And also, it carries a lot of iron. A red cell is filled with iron. So this is the shape of the red blood cells, which are also called erythrocytes. And this would be the side view of it. And you can see there's a little indentation on the top and on the bottom. And some people will tell you it's because that the nucleus has been lost. Once it's in the bloodstream, it no longer has a nucleus. That nucleus is lost. And so therefore it has a little bit different shape than it would have if it had the nucleus. That would be the hemoglobin red blood cell. Now I have another chart here that I want you to see. This is just a chart of a cell. Cells are made of protein, fat, sugar, starch, minerals, vitamins, and enzyme. What is an enzyme? An enzyme causes a chemical reaction to occur. It's a substance that enhances or causes another chemical reaction to occur. 65% of that cell is oxygen, but the rest of it are other substances and gases. 18% carbon, 10% hydrogen, 3% nitrogen, 1% calcium, 1% phosphorus, and 2% various elements, other various elements. But it's the red blood cell that we are most interested in going into. So let's have the next chart. I'm going to have to watch my time because we're getting kind of close here. So we can have the next chart, and I'm going to be discussing the A1C test. The A1C test is a test that shows the average blood sugar for the last 3 months, 3 or 4 months. The hemoglobin, which I mentioned in the red cell, attracts sugar, and the sugar attaches itself to the red blood cell. And the more sugar you have in your blood, the thicker and the greater the amount of sugar that attaches to the red blood cell. And it will stay there for the life of the cell. Most cells, red blood cells, live for about 3 months. And so if a sugar is attached to the red blood cell, then it'll stay there for the whole 3 months. And when you take a blood test of a person, you do it on a 3 months basis because that's how long the cell lives. You take the sample of the blood and you can tell how much sugar is on the blood, and so you can tell how high your blood sugar has been for the last 3 months. Now on the next chart, I just want to finish it off with the next chart that we have on the values that occur. On the values that occurred now, it is a percentage. The way that the A1C, the hemoglobin A1C test is valued at, there are various numbers, various percentages. For example, it goes from 4 to 13, and I'll just run over this quickly and then we'll close with this. But if you have a value of 4, that means your average blood sugar has been 60 for the last 3 months. If your value is 5, then it's been 90. If it's 6, then your average blood sugar is 120 and you're getting up toward the diabetic phase. If it's 7, it'll be 150. If it's 8, it'll be 180. 9 is 210. 10 is 240. That's seriously way too high blood sugar. 11 is 270. 12 is 300. And 13 is 330. So you can see the higher amount of sugar on the blood gives them an indication of what your average blood sugar has been. And it's very important that you keep your blood sugar down. A non-diabetic's blood sugar will be about 5. You're going to have something, of course, because there is going to be some value or some sugar on your blood cells. But if you get higher and higher, 6 is not too bad. Below 7 or 7 is not too bad. But a diabetic will get to 8, 9, 10. And if you're sick, then your blood sugar is going to go sky high, because if you're sick, your body does not know what to do about it, and then the liver starts pumping sugar into the system, and your blood sugar goes sky high. So expect it if you're sick, you're not feeling well, you're under too much stress, something's happening in your life that you can't control, that's automatically going to push that blood sugar up, and so you will have a higher reading. Also, you need to remember that there are different types of A1C tests, so the values may differ a little bit, but this is basically what it is. So I'm going to close it here. We're about out of time, and I will continue with this next time, and so please join me then.